Diolch, Dirprwy Lywydd, and I genuinely welcome both of the strategies, mental health and wellbeing, and the suicide and self-harm prevention strategies, and the consultations, and join the Minister in urging people to put their thoughts into this and how we take this forward. When I was a very young man, a long time ago, we were a very tight group of 5 of us that always went everywhere together. We were idiots, but we were never bad, but we were idiots. And then we went our own way to college and to jobs and so on. And one of our tight little group, took his own life. Out of the blue, the most vivacious, the most outgoing, the most extrovert, the most talented of all of us. And I often stop and think, what if? And that's why what really leaps out at me in the statement today is where you say the approach recognises that suicide and self-harm are not diagnosable mental health conditions. Many people who die by suicide are not known to mental health services. And there is also a prevailing misconception that people who die by suicide have a mental health illness. It's vital we challenge the perception to remove the stigma and support people who need it. I so much agree. And can I, along with Jack, who said some of the excellent work that's going on in groups out there, if you or your officials want at any time to come and visit the 14 volunteers in the Ogmore Vale Suicide Awareness CIC, who work with local groups and organisations, football clubs, rugby clubs, various local groups, to raise awareness of the support that's out there for people who can really help them and have those conversations as well. And they organise coffee mornings and so on. So, Minister, if you ever want to come and chat to somebody down our way, I'm sure they'd really welcome it.
Thank you very much, Hugh, for your welcome. And I'm really sorry to hear about your friend. You know, that's something that affects people for the rest of their lives. And you know, is that what if, isn't it, really? And it's important that we all remember that as well as suicide not being a mental health, although it's, it can be a mental health issue, but it's not necessarily a mental health issue. We also have to remember that suicide is not inevitable. Absolutely. And there are opportunities for prevention, and that's what this new strategy is about, seeking out those opportunities for prevention and really going at every single one of those. Thank you for highlighting the group in your constituency, Suicide Awareness CIC. I didn't know about that, and I'd be very happy to meet with them. Just to say as well that we have developed engagement packs to work with both the strategies, so the groups can have the packs and they can use them to consult with their own members. So if any members know of any groups that they think would like to be involved in the consultation, if you could email me, that would be brilliant, because we're keen to get the maximum amount of engagement. Thank you.